Hi, my name is Mallory Ann Herron. I am 26 years old. I got my LPN license from River Oak Technical College. I graduated there in the year of 2017. I am applying for the LPN to RN Bridge program for the 2022 to 2023 school year. I started my nursing career at Madison County Memorial Hospital. I worked med-surg and a little bit of ER. I learned a lot about disease processes while I was on med-surg, and I also worked my first code in the ER. I was there for about a year before I moved to Sarasota, Florida, and I worked for Florida Cancer Specialist Drug Development Unit for Phase 1 Research Oncology Drugs. I learned a lot there, everywhere from oncology drugs to reactions, to taking patients' vitals every 15 minutes, and venue punctures, and also EKGs. We then decided to move back to Live Oak, Florida, where I started at Advent Christian Village as a floor nurse. I learned a lot about long-term care and the elderly. I soon then applied for the management position of a dementia unit. I learned a ton there, from antipsychotic drugs to managing a whole unit, from scheduling conflicts to interviews, working very closely with administration. It was definitely a difficult job. I then resigned there to go work for Kindred at Home, whom I'm with now. I love this job. I think my favorite part about being a home care nurse is education. You don't realize how much people don't know about their own bodies, which is crucial to them improving.
When working in a team, what role do you typically enjoy or find most compatible with your personal skills?
I would say leadership for sure. I love leading people, not telling them what to do per se, but educating them and directing them to become a better person, whether that's a CNA or a nurse. I love taking that role on and showing them what they can be capable of.
Provide an example of a learning experience from working with the team.
A learning example that I have learned was down in Sarasota at Florida Cancer Specialist. Their communication was key. We would have a patient up on the chemo floor on a second story administering a drug, and once the drug was administered, we would have to send them back down to a lounge where they would hang out and be monitored for any reactions. During that time, you would have to pass on to the nurse, this is where I am at, this is when the person's going to need an EKG, vital signs, lab draw, and time is crucial. We have to get that time down to the seconds. So communication, I would definitely say, was a learning experience, because if you did not communicate something, it would definitely mess something up in the study.
Tell about a time when you didn't know the answer to something important. How did you go about finding that information?
A time where I needed to know the answer to something was when we had a patient at Advent Christian Village who needed to go to the hospital for some low blood levels. We got the patient up and ready, and they refused to go. EMS was trying to get them on the stretcher, and they kept refusing. And although the patient had an Alzheimer's diagnosis, they were still able to make their needs known. So I had to call the risk manager, also the physician, and family members who were in charge of their care. We ultimately came up to the decision to not send the patient to the hospital due to the patient's request, and then the family member agreed. The patient was soon after placed on comfort care. But everybody, including the physician and risk manager and mine and the family, made the decision together.
Give an example of a difficult situation you've encountered in a professional environment. How did you handle that situation?
As you know, nurses become very close with their patients. In Sarasota, Florida, working oncology, you often became close to them through emotions and having sympathy and empathy for their family members and the patient. And when you see your patient have a reaction, not only are you supposed to get that reaction under control, under the direction of the physician, but you're also supposed to be there for the family members. So I would definitely say handling a reaction, getting that IV placed so the patient doesn't die, and also after that, keeping calm and being there for the family. Becoming an RN has always been a dream of mine. It's going to open up so many more opportunities for my career. Thank you for considering me to become a student of the LPN to RN Bridge program. I cannot wait to become an RN.